Hello and welcome to my YouTube channel where we will be discussing different aspects related to infertility and its treatment. In our earlier episodes, we have discussed various aspects related to IVF, how to select an IVF clinic, what does success in IVF mean, polycystic ovarian syndrome, and today I shall be talking about endometriosis, the disease and its impact on infertility and its management. Make sure that you subscribe to my channel so that you don't miss out on any issues related to infertility. Endometriosis is an estrogen dependent chronic inflammatory condition that is characterized by the presence of viable endometrial tissue outside the uterine cavity. It represents the commonest cause of pelvic pain, dysmenorrhea, and infertility, and is frequently seen in the ovaries, other pelvic organs like bladder and rectum, the pelvic peritoneum, and the rectovaginal septum. It is a challenging condition which can have a negative impact on the social, mental, and the physical well-being of a woman, and it directly has a negative impact on the quality of life. Due to the absence of a single reliable test to diagnose, it is very difficult to estimate the exact incidence of this condition. However, it is believed that nearly 10% of women worldwide and nearly 30 to 40% of infertile women having pelvic pain have some or the other form of endometriosis. It is present in three forms: ovarian, peritoneal, and deep infiltrating type. Peritoneal endometriosis is characterized by the presence of red, brown, or black spots anywhere in the pelvic peritoneum. This can lead to the development of inflammation, fibrosis, and subsequently adhesions where different organs can get stuck. Ovarian endometriosis is characterized by the formation of a chocolate cyst or endometrioma. This is a blood-filled cyst in the ovary. Now, this affects the ovarian function in multiple ways. As the cyst grows in size, it destroys the surrounding normal tissue. In addition, there is also a lot of local inflammation which also affects the production of eggs. So, such endometriomas ultimately lead to a destruction in ovarian reserve. The commonest feature of endometriosis is any kind of pain. This could be at the time of periods, at the time of intercourse, at the time of passage of urine or stool, or sometimes even constant dull pelvic pain. On clinical examination, the pelvis and the pelvic organs are extremely tender, or you can palpate large ovarian masses. Ultrasound helps in confirming ovarian endometriomas, but other type of endometriosis may not be seen on ultrasonography. So the gold standard to diagnose endometriosis is to perform a minor surgical procedure called laparoscopy, where a telescope is put inside the pelvis to visualize the various pelvic organs. Sometimes a MRI or a CT scan also aids in diagnosis. The treatment of endometriosis depends on the type and the severity of the disease and the presenting symptom. When the primary presenting symptom is pain, simple painkillers, progesterones, or drugs like oral contraceptive pills or GnRH depots which suppress menstruation are commonly used. However, when the pain is not responding to this, or when the primary complaint is infertility, then laparoscopy is of immense value. Apart from confirming the diagnosis, it also helps in correcting some of the pathologies. For example, if there are minor adhesions between the uterus, tubes, and the ovaries, which would interfere with the passage of the eggs from the ovaries into the tubes, these adhesions can be easily removed. If there are presence of chocolate cysts in the ovary, this cyst can be drained and the cyst wall completely excised. However, apart from the normal drawbacks of any surgical procedure, there is also a potential risk of reduction in the ovarian reserve. IVF is ultimately the treatment of choice for a large number of patients with endometriosis. If the disease is very mild, we can do simple procedures like intrauterine insemination. However, when the disease is advanced, when the ovarian function is diminished, doing an IVF is most cost effective. There is also a role of fertility preservation in women who have ovarian endometriomas and do not wish to have a child immediately, because this endometriomas can lead to progressive destruction in ovarian function. So we can remove the eggs and preserve them if the woman is not married, or create embryos and preserve embryos if the woman is married but does not want a child at this moment of time. So endometriosis is one of the commonest cause of various types of pelvic pain in women. It has got various treatment options depending on its severity, type and the presenting symptom, and one should not forget about preserving fertility or carrying out fertility promoting surgery or IVF for these women suffering from endometriosis.